Hello and welcome to Healthy India, a platform through which we bring various health experts to the studios of Lok Sabha TV so that they could educate you about various health issues and you could also interact with them. I'm your host for today, Charu Karthike, and today we'll be talking about juvenile diabetes. For discussing this health issue and explaining various facets of it, I have an esteemed panel of health experts in the studio with me. On my extreme left is Raheja Jaiswal from the Department of Dietetics, All India Institute of Medical Sciences. Next to her is Dr. Sunil Raheja, physician, GB Pant Hospital. Dr. Raheja has been honored with the State Award 2008 by the government of NCT for Delhi. Welcome both of you. And next to Dr. Raheja is Dr. Vandana Jain from the Department of Pediatrics, again All India Institute of Medical Sciences. Welcome, Dr. Jain.
Thank you.
Before we begin the discussion, before I start posing questions to our esteemed panel of experts, let us now show you this report, which will kind of give you a brief preview about juvenile diabetes. Type 1 diabetes, also called insulin-dependent diabetes, or juvenile diabetes, is an autoimmune disease that occurs when pancreas undergoes an autoimmune attack by the body itself and is rendered incapable of making insulin. In the past, this was also called insulin-dependent diabetes mellitus or juvenile onset diabetes mellitus. In such autoimmune diseases, the immune system mistakenly manufactures antibodies and inflammatory cells that are directed against and cause damage to patients' own body tissues. In persons with type 1 diabetes, the beta cells of the pancreas, which are responsible for insulin production, are attacked by the misdirected immune system. It is believed that the tendency to develop abnormal antibodies in type 1 diabetes is, in part, genetically inherited, though the details are not fully understood. Exposure to certain viral infections or other environmental toxins may serve to trigger abnormal antibody responses that cause damage to the pancreas cells where insulin is made. Type 1 diabetes tends to occur in young, lean individuals, usually before 30 years of age. However, older patients do present with this form of diabetes on occasion. Of all the patients with diabetes, only approximately 10% of the patients have type 1 diabetes, and the remaining 90% have type 2 diabetes. Among the risks of the disease are serious complications, among them blindness, kidney failure, extensive nerve damage, and accelerated atherosclerosis. The long-term aim with treatment is to avoid these complications, or at the least, to slow their progression. There is no known cure. Well, there was a brief introduction about juvenile diabetes from our side. I think this will be a good time to go over to you, Dr. Raheja. What is basically, if we talk in simple terms, what is juvenile diabetes?
Juvenile diabetes, also called type 1 diabetes. And diabetes mellitus is basically a metabolic disorder which is characterized by polydipsia, that is excessive intake of water, polyuria, excessive passing of urine, polyphagia, and loss of weight. The word diabetes itself is taken from a Greek, which means siphon. Siphon means throwing out the fluid from the body. So this is the basic symptom which was recorded way back in 2020 AD, when they noticed that few patients who have this kind of disorder had polyuria. They were passing excessive amount of urine. Besides this, it is also at times, this is maybe asymptomatic. Like I had a patient, a young boy of 20 years, who was playing football. He came to me just with a history of vomiting and cramps in the abdomen. And when we taken a detailed history, he gave us the history of loss of weight, increased appetite, polyuria, polydipsia. And when we went for a routine examination, the blood sugar of the patient turned out to be 439. So it is not necessary that it may be diagnosed only on the symptoms of the patient every time. A person with high blood glucose level may be asymptomatic. And in type 1, the peculiar thing is patient may be diagnosed only when the person develops ketoacidosis, which can be induced because of some stress and because there is no insulin in the body being produced by the pancreas. So when glucose is not being utilized by the if the insulin works as a key to the cells. If there is a glucose in the blood, it is being utilized by the cells of the body, muscle cells and fatty cells. It can only utilize if there is insulin. It's the anabolic hormone.
Right. Vannaji, why do we need to classify this disease into various age groups? I mean, why diabetes for adults, or why a juvenile diabetes?
Yes, your question is very right and very basic, because many people still have this mistaken thing that both the diabetes are same types, and they are, in fact, to my mind, they would be at two spectra of one continuous continuum, but they are quite different in their pathophysiology. As you've already shown in your video, type 1 is when there is destruction of the pancreas by a process known as autoimmune, that is, the body's own cells somehow destroy the pancreas, and therefore there is no insulin. Whereas in type 2, that is the disease which usually manifests in adults, usually above the age of 30, and usually in obese patients, and that is a condition in which insulin is being produced to some extent, though not to as much an extent as in a healthy individual, but the cells, body cells, are resistant to that insulin. So there are some oral drugs which can help the person by making him again sensitive to insulin. But in the type 1 diabetes, since there is no insulin, so drugs cannot help. You have to give injection of insulin. And type 1 diabetes usually manifests in young individuals. It can manifest in babies as old as 6 months to 1 year of age also. And there are two peaks of presentation in childhood. One is at the age of 4 to 5 years, and the other is at the age of 10 to 11 years. And usually it presents, as Dr. Raheja rightly said, in patients younger than 30 years of age.
What does this disorder do to the human body?
What it does is that since the insulin is not there, insulin is required for the glucose to enter into the body cells, and therefore once the glucose enters into the body cells, only then the cells can use it for getting their energy. Whatever we eat, ultimately we eat it because we need energy. The energy is needed at the level of the cells. So the glucose is there, whatever we are eating, the glucose is there in the blood, but it can't enter the cells. So in fact it just filters out through the kidney. So the patient passes a lot of glucose, and because the glucose is an osmotic substance, so it drags out a lot of urine also, a lot of water also. So the patient gets dehydrated. And though the blood sugar levels are high, but there is no energy in the cells where it is needed. So the patient feels totally exhausted.
Dr. Raheja, would you like to add something to that?
She has rightly said, even though there is glucose in the glucose levels are there in the blood, but the cells of the body, they fail to utilize it. As I have told you that insulin works as a key, opening a lock by which the glucose can enter the muscle cells and fatty cells. And once the glucose cannot be utilized by the cells, the person will have easy fatigability, weakness, lethargy, and may complain of dizziness, and all these symptoms are there.
How does a faulty diet, or how is it responsible? Is it actually responsible for this disease, this disorder developing in the human body?
Acharu, before I start anything, I want to add one thing first, that insulin is the only thing which should be, that is a treatment, and diet is plus. Diet is going to give a good lifestyle, and dietary modification is needed for proper growth, because since it is affecting a very young age people also, and for proper growth of a person, and to avoid any comorbidities as Dr. Vanna already mentioned, that can affect kidney or in later stage, and that should be planned according to the child own physical activity and the age.
Right.
So that is very, very important. In plus of insulin, the diet should be modified accordingly, and carbohydrate and sugar is a very important part for to provide proper energy. So that should be included in
Right.
diet. But how and how much and when it should be given, how it should be given, that should be according to a particular patient.
If you could tell us about the general pattern, I mean, what mistake do people do in proper dietary patterns so that this develops in the human body, this disorder develops?
Can I just
Yeah, sure.
you once? That again, what we are trying to say is that diet is not responsible in any way. No,
in any way.
This is a misconception that many patients come with, that maybe my child used to eat a lot of sugar and that is why he has gone on to develop type 1 diabetes, but that's not true.
Okay.
That may be to some extent true for type 2 diabetes, the adulthood diabetes, because the resistance to insulin is associated with obesity, and eating a lot of sweets also makes you fat. So being fat is a risk factor for type 2 diabetes, but type 1 diabetes, diet cannot cause diabetes.
So you can say that categorically.
Yeah, it is very categorical, and no parent should feel guilty that maybe I did not stop my child from eating a lot of sugar and a lot of sweets, so he has gone on to develop diabetes. No, it has nothing to do with what the child is eating.
Okay.
It may be some viral agents, it may be body's own autoimmunity going wrong somewhere, but it has nothing to do with the dietary pattern of the child.
I think that's something very important that you've mentioned. Yeah.
It's more of a genetic disorder in 90% of the cases. Type 1 is again type 1A and type B. 1A is basically, it's a genetical disorder which is autoimmune, and it is more common in the parents of the children who have this disease, up to the level of 5 times. If the father has a diabetes, the child of the father has 8% chances of developing diabetes.
8%. 8%.
Yes.
Okay.
And if the mother has got the same problem, diabetes type 1A, the chances of developing the diabetes in the child is 3%. So overall it comes around 6% if the parents have got diabetes.
Okay.
And again, this is precipitated by few viral illnesses, like there is one virus, Coxsackie B, which is being taken up. And it is more common in...
What is the difference between 1A and 1B?
1A is basically genetically mediated.
And 1B?
1B is idiopathic. We cannot really define the cause in 10% of the cases. It may be viral illness, whatever it is.
Okay. So largely speaking, what is the instance, if we speak in terms of percentage, what is the instance of people affected with 1A and 1B?
1A is 90%, 1A...
90% of patients who come with diabetes type 1 suffer from 1A.
Yes.
Okay, and only 10% from 1B.
Yes.
So genetics are mostly responsible for...
Yes.
1A is more of autoimmune rather than calling it genetic. Genetic factors have a role, but it's not that it's totally genetic. 1A is autoimmune, meaning that there are some cells in the body which work against pancreas. Normally what we have an immune system which protects us from diseases, from various infections. When a bacteria comes or a virus comes, our cells fight against it. So they don't fight against our own tissue. But here the cells, there's something wrong. It could be something genetic, it could be some viral triggering factors which make those cells go haywire, and they start attacking the body's own tissue. That is the pancreas, the beta cells in the pancreas specifically.
Right.
So 1A is autoimmune, where if we do some blood tests, we can find out some autoantibodies like GAD antibody and some other anti-insulin antibodies.
Right.
Those antibodies will be present.
Okay.
1B
we'll come to these tests in a while. We're having a very interesting discussion. There's some very important points being clarified by our experts here. It's time for us to slip into a short break. We'll be back in a short while.
Images that speak, art is revealed, expressions.
ऑटो साकेत चलोगे? ऑटो साकेत चलोगे? ऑटो ऑटो कहाँ चलेंगे साहब? साकेत चलोगे? चलेंगे क्यों नहीं साहब? नहीं चलेंगे तो मीटर कैसे चलेगा? मीटर भी चलोगे? सर जी, अपन तो करते हैं वही जो होता है सही। ग्राहक ही मेरा भगवान है, और भगवान से ही धोखा कर कमाएंगे तो धूल झाड़ते रह जाएंगे। चलिए।
Are we seeing the first signs of revival in the Indian economy, or do we have a long way to go? Discussing these questions are Professor Badal Mukherjee of Delhi University and Vivek Bharati, economic analyst, on Head Start, only on Lok Sabha television.
Watch Agenda, a live discussion from the studio of Lok Sabha television, On Agenda Before the House, a glimpse at the day's schedule in Lok Sabha. Monday to Friday, 10 a.m. Welcome back to Health India. Today we are talking about juvenile diabetes. Well, Dr. Raheja, since insulin is at the heart of diabetes, whether it be type 1 or type 2, I was wondering whether you could tell us a little more about the importance of insulin to the body and what types of insulin are there.
Insulin, as I have told you, it's anabolic hormone which is secreted by the beta cells in the pancreas, and it is basically very important for the metabolism of carbohydrates, fats and proteins also. And the types of insulin available in the market are short-acting insulin, intermediate-acting insulin and long-acting insulin. In the short-acting insulin, we have got the regular human insulin. Earlier we had bovine and porcine, which are discontinued because of the antigenic effect. And we have now insulin analog also in the market, insulin Lispro and Aspart. Insulin Lispro and Aspart, they are short-acting insulin, and they are really very good to control the post-prandial surge in the diabetic patients. And the intermediate insulin, we have got the Lente insulin and NPH. And the long-acting, we have insulin Glargine and insulin Datamir. And to be very honest, till date, there is no insulin which can really match the natural secretion of insulin in the body to the surge of hyperglycemia in the blood. But still we are in the way of, we have long-acting insulin which can be given, insulin Datamir and Glargine in the evening or late night, and this can be supplemented by the insulin Lispro or Aspart prior to the meals. We can make it tailor-made to the patient's eating habit. If the person is having a heavy dinner, we can increase the dose of insulin Lispro or Aspart.
Right.
Did you get me?
Right.
And if a person is going to skip a lunch, maybe because of office work, because then it won't be covered. You know what happens in the body? There is a basal release of insulin by the pancreas round the clock 24 hours. So to meet that requirement, we can give a shot of long-acting insulin supplemented by the short-acting insulin before the meals.
Right. Well, at this point of time, I would like to tell our viewers that we have opened our toll-free numbers, our phone lines, on which you could call and put your questions to our experts sitting here directly so that they could answer your queries. Please note down our toll-free numbers. They are 1800-115314 and 230-35420. I repeat the numbers. They are 1800-115314 and 2303-5420. Dr. Bandhav, earlier in the show, a couple of moments ago at the beginning of the show, Dr. Raheja told us about one symptom, excessive urination of
Right.
juvenile diabetes. Apart from that, are there any other symptoms so that which could help us identify juvenile diabetes?
Yes, the most common symptoms are again the same as Dr. Raheja said, weight loss, and child is eating a lot, he's drinking a lot, but he's losing weight. And the child also appears to be a bit lethargic, or he doesn't feel good, because as we discussed earlier, there's no energy in the cells. The child feels exhausted all the time. And let's say around 60 to 70% of our type 1 diabetics, the kids, they get diagnosed because of these symptoms. But then, many parents and even many doctors don't have this understanding that children can develop diabetes. So many times this does not come into the differential diagnosis. Even if a parent visits a doctor with these symptoms, the child is feeling lethargic, exhausted. So many times children don't get diagnosed with this, and they present in ketoacidosis. Diabetic ketoacidosis is a very severe kind of a presentation of diabetes. Around 30 to 40% of children present in that way, that they become unconscious or comatose or very drowsy. They become dehydrated. They have acidotic kind of that is a very fast breathing, and they have vomiting, abdominal cramps. So that kind of presentation, and which they usually land up in emergencies in hospitals. And then sometimes when blood tests are done, they are diagnosed. And sometimes in smaller hospitals or in primary care centers, again, they may get all sorts of treatment without actually blood sugar being checked. So it is important that if a patient presents to a doctor with sudden loss of consciousness, vomiting, abdominal cramps and these kinds of symptoms, then the blood sugar should be checked. and then the treatment is to give him fluids, a lot of fluids intravenously and insulin.
Okay. Well, we already have a caller online. He is waiting. Let us take up his question. Then we'll take this subsequently in the program. A caller is waiting on the line, so we should first take his question. We have Vishal from Rajasthan. Welcome to the show, Mr. Vishal. Please go ahead with your query.
Yeah. Good evening, everybody. I have been suffering from pancreatitis for the last 5 years. And now, 2 years back, I was diagnosed with diabetes. My fasting sugar level was 350 and after food was somewhere around 450. Right now, I want to know whether there is some treatment regarding with the use of stem cells for diabetes or not. That's it. That's my question.
Okay. Dr. Raheja, did you get him?
Yeah, can you just tell me your age, sir? And since when you are suffering from this disease?
My age is 22 right now and I've been suffering since I was 15 years old. So it's about 7 years now.
Yeah, basically he is a case of type 1 diabetes, and I think the patient of type 1 diabetes, they need insulin for their life. And there are few studies in which they have done a pancreas transplant. And but again, as doctor, again it's an autoimmune disease. So it is being noticed that after after a very short time, the beta cell being transplanted or pancreas transplantation, they get destroyed because of the autoimmune process. So it is not really a good choice of treatment at this moment. And beside this, there are few immunosuppressant drugs which are going on trial, like mycophenolate mofetil is under trial at this moment, and this drug is being tried for pancreatic transplants and the people who had a HLA DR3 DR4 genotype. And for this particular patient, I think he should remain in regular touch with his physician.
Right.
And he has to take care of a regular insulin injections,
right,
diet control, exercise, and he should keep himself stress free as much as possible.
Right.
And he can do aerobic exercises, yogas, right, and a diet which is rich in high fiber.
Right. I think basically these are all the things which his doctor would have prescribed him, so he should essentially be in touch with his doctor quite frequently. We have another caller in line. We have Divya from Hyderabad. Welcome to the show, Divya. Please go ahead with your query.
Hello, sir. Divya is suffering from diabetes since 8 years of her age. Now she is aged 20 years, sir. Is there any possibility that if a genetic test is conducted, that she is able to get any permanent cure for the same?
Vannaji, would you like to take that up?
This question is something similar to what we just heard.
Genetics.
Till now, there is no such cure which is available. Worldwide, some trials are going on, but nothing as such for the which can be prescribed to a patient right now. She has to continue on insulin only. There's no genetic cure.
Right. Raheja, I think we should come to you now for the dietetics part of it. How would diet help in controlling in the worsening of this disorder?
If I have to plan a diet for a IDDM patient with juvenile diabetes, two things I want to separate. That one, patient is normal but suffering from diabetes, and the child is suffering from some therapeutic, some clinical problem. That child has some clinical problem and associated with IDDM, or maybe that could be a other thing. So if child is absolutely normal and suffering from IDDM, then dietary plan should be, then I would prefer to take care of his physical activity, how much insulin he is having, at what time and which kind of insulin he is having, and accordingly diet should be planned, and that dietary pattern should be according to that child own schedule, not according to our own schedule.
Okay.
And nowadays two types, so as sir said, that two types of insulins are mainly given to a patient or child. One is a rapid acting and one is a long acting, or the combination of these two, short and long. So if it is a rapid, then dietary diet pattern should be as a counselor, I need to give a proper counseling that diet should be taken immediate after, just before insulin, the diet, immediate after taking insulin, that person has to eat well, and diet should be planned accordingly. And if it is a long acting, then long acting or mixture of these two, then diet should be planned. 6 meal pattern we say, 3 major and 3 minor. So accordingly I will plan.
Okay.
And if somebody has clinical problem also, and along with that IDDM, then definitely I have to take care of that clinical problem also, and I have to plan diet according to insulin and plus clinical condition. Major factors while planning diet, everybody is aware about that diet should be carbohydrate distribution is important. How much carbohydrate we are giving according to insulin at what time, that is very important. Fiber should be included in diet. And nowadays fat is in a like seen that how much fat is also very important, but which kind of fat we are giving and through which source, that is very important. That should be properly included. And that diet should compromise with all nutrients should be included in that to provide proper growth to that child.
Okay.
So that these entire things are very important.
So dietary treatment should be planned according to the individual lifestyle and individual health profile of the patient.
For pediatric.
Of the patient.
For
right.
Pediatric
We would continue discussion. We have another caller waiting online here. We have A.K. Mahajan from Delhi. Welcome to the show, Mr. Mahajan. Please go ahead with your question. Hello, Mr. Mahajan, are you there with us? Okay, I think well, he has disconnected his call. Probably we might try to get him again.
You know, she was talking about the diet. The diet should be planned which is rich in fiber and has a low glycemic index. And when we talk of glycemic index, you know, the body behaves differently to this carbohydrate carrying the same amount of calories. I mean, there is a different surge of blood glucose as well as insulin secretion. For example, we take glucose as a high glycemic index at 100%. When a person is taking glucose, there is a sudden surge of blood glucose level in the body, and because insulin is not there in the body, it's, I mean, in a normal person the pancreas is there to pump insulin accordingly, but in diabetic this luxury is not there. So if the person is given a diet which is having low glycemic index, like oats, high fiber diet, brown bread, soybean. Like soybean has got just a very low glycemic index, 30%. Brown bread has got 70%, whereas glucose is at 100%. So we should give the diet which is rich in fiber, I mean whole grain lentils, brown rice, brown bread, and also the carbohydrate should be around 55 to 60% of the calories. The fat should be given in the ratio of 20 to 25% of total calories. And in that also we should see that we give saturated fat not more than 7 to 10%, because these diabetics, they have dyslipidemia also. Did you get me? And also the protein intake should be restricted to 0.8 to 0.9 gram per kg body weight, because in the long run the diabetics have a serious complication of end stage renal disease. So we have to work on these components from the day one, so that we can prevent the long-term complications over a period of 10 to 15 years,
right,
which can be microvascular as well as macrovascular, which can include your eyes, brain, heart, kidneys, nerves,
right,
neuropathies.
Right. Since you mentioned this, we'll come back to what organs of the body does this type of disorder affect. But before that, it's time for us to take another break. On the other side of this break, we talk about preventions to stay away from juvenile diabetes.
साहित्य भवन की क्या है हलचल, सृजन क्षेत्र में क्या है खास, कोरोना किताब संग जानेंगे हम, झरोखों से आई किसकी याद। देखते रहिए साहित्य संसार हमारे साथ सिर्फ लोकसभा टेलीविजन पर हर सोमवार रात 8:30 बजे।
Hello and welcome to In Transit.
Slumdog is definitely a very important work, because given the fact that It was a far more difficult film to be able to be shot live in Bombay.
Relationships have become duty, beyond duty.
Some of my photographs were published in a couple of newspapers and magazines.
Welcome back. You're watching Healthy India, and today we are talking about juvenile diabetes. We already have a caller online waiting. We have Mr. Vipin from Pune. Welcome to the show, Mr. Vipin. Please go ahead with your query. Mr. Vipin, are you there with us?
Yeah, I'm here.
Yeah, please go ahead with your query.
See, what is the question of mine? Basically, my father has diabetes earlier, and I am also at the edge of the diabetes. Sometimes it goes up, sometimes when I go for testing, it comes down. So what I'm thinking is how to take a precautionary measure for my children, because my daughter is of 12 years old. So because right now she is okay, and because in future I am worried. So what all dietary control I should do for her?
How old are you, Mr. Vipin?
I am 46.
46.
Yeah.
Okay, Richaji, would you like to take that up?
Yeah, dietary control means nowadays even pediatric population, even at a very young age, people get affected by diabetes, even type 2 diabetes at very young age. So it's better to he can plan diet. I mean that diet should be balanced, and lifestyle management is also required. It's not just that entire day that girl is eating, means his daughter is eating a complete diet and she is not burning calorie. If I am telling about balanced diet, it should be balanced with physical activity. So, and if she is going out, she should be conscious enough, or her parents should be conscious enough what all she is eating. Once in a while she can enjoy each and everything, but since she is prone for developing diabetes in later stage maybe, so she should take care of at early age. Diet should be rich in fiber, carbohydrate also should be there, but that should be complex carbohydrate mainly, and fruits and vegetable encouraged more to add in diet, and lunch pack. And she shouldn't avoid meal. There shouldn't be a major gap between two meals. That is also very important. So breakfast is very important, and she should go for a balanced diet. Balanced diet we have already covered earlier. So
to this,
right.
I would like to add something.
Yes, please go ahead.
That what the type of diabetes that Mr. Vipin has talked about seems to be type 2 diabetes, and type 2 diabetes is a very strong hereditary pattern, much more stronger than type 1. So he is rightly worried that his daughter may go on to develop. For that, he should primarily watch her weight, because ultimately diet, lifestyle, they all add up to your weight. So as long as she is maintaining a healthy weight, she is unlikely to develop diabetes, and he should encourage a right diet and right lifestyle for her.
Right. Well, we have another caller online. We have Mr. Narayan Sagar waiting online. Welcome to the show, Mr. Narayan. Please go ahead with your query.
See, I have a nephew who's 16 years of age now. He got juvenile diabetes at the age of 5, and he is on regular insulin dosage. Now, I wanted to know in what way stem cell therapy can help him to get over it.
Dr. Raheja, stem cell therapy?
This is all under trial, and as I have told you, the transplant of beta cells in the pancreas, and that is followed by immunosuppressants, cyclosporin and rapamycin, and which is again a very toxic, which has got a lot of side effects, and that is also to be evaluated. And let's see in future what comes out. It's basically under trial with the National Institute of Health, USA and Canada. They are doing all this research.
So I believe as of now there is no sure shot cure for diabetes.
Yes, as of now, today you have to take your insulin sincerely, regularly, as per the advice of your physician. Go for regular checkups, have diet control, exercise.
Right.
And let's see in future we come out with some good results with the new research going on. But again, the immunosuppressant drug, like, they have got side effects also. So it's an autoimmune process. Till date, we are not really coming out with a very good result.
Right. Mandaji, since we were talking about weight, and since you also told our caller to watch the weight of his daughter, how clear is obesity an indicator of type 1 diabetes?
Obesity is more associated with type 2 diabetes and not with type 1 diabetes. But in type 1 diabetes also one has to watch one's weight, because there are many kids who get diabetes when they are 4-5 years of age, but as they become adolescents, and as we know, obesity has almost become an epidemic amongst urban adolescents. So if they gain weight, their insulin requirements go up. If a child was being maintained at 25 to 30 units of insulin per day, we will find that it goes up to 50-60 units of insulin, and still the blood sugars are not very well controlled. So even for type 1 diabetics, watching the weight is important because it helps in maintaining a good blood sugar control.
Right. Well, we have Kuldeep Singh online from Chandigarh. Welcome to the show, Mr. Singh. Please go ahead with the question.
Sir, I want to ask from the lady doctor जो पैनल में हैं कि एक अडल्ट को जो नॉर्मल अडल्ट है उसको डायरेक्ट शुगर की क्वांटिटी कितनी पर मंथ लेनी चाहिए, वो नॉर्मल इंसान विदाउट प्रॉब्लम ऑफ डायबिटीज. जैसे कि ऑयल की क्वांटिटी होती है वो होती है हाफ केजी पर मंथ पर मेंबर को लेना चाहिए, ऐसी शुगर की जो है क्वांटिटी कितनी डायरेक्ट लेनी चाहिए पर मंथ.
शुगर की क्वांटिटी व्हाट ही वाज आस्किंग, शुगर की क्वांटिटी कितनी लेनी चाहिए. लाइक शुगर सुक्रोज जो है, जो टेबल शुगर जिसको हम लोग कहते हैं, ये अगर डाइट से हटा भी दी जाए तो कोई खास फर्क नहीं पड़ता. ये हमारे शरीर के लिए कोई जरूरी चीज नहीं है. कितनी ऊर्जा हम ले रहे हैं खाने में, वो हमें हमारे शरीर को काम करने के लिए प्रेरित करती है. ठीक है, हमारे शरीर को काम करने के लिए ऊर्जा देती है, जिसको कि हम कार्बोहाइड्रेट कहते हैं. कार्बोहाइड्रेट हम कुछ भी खाएं, चाहे हम रोटी भी खाएं या हम दाल खाएं, सब्जियां खाएं, फल खाएं, इन सब चीजों में कार्बोहाइड्रेट होता है. तो ऐसे स्टेबल शुगर रिक्वायर्ड नहीं है. इसकी क्वांटिटी जितनी कम से कम की जा सके उतना अच्छा है. इसकी कोई रिकमेंडेड डोजेस नहीं है कि ये 5 ग्राम ही खाना चाहिए या 10 ग्राम ही खाना चाहिए, पर इससे ज्यादा ना हो एक नॉर्मल इंसान की लाइफ में तो अच्छा है.
How does one ensure that one does not use excessive sugar in the diet?
Then it is not going to affect type 1 diabetes.
How does one ensure that we keep a diet which does not have much sugar in it?
Direct sugar you can see easily. That shouldn't be like diet which is providing directly, which is made directly through including all sugar and which is rich in sugar, like all chocolates and sweets. These things are rich in sugar. These things they make with the help of sugar. So this thing should be included in diet in a lesser quantity or occasionally. Right. A person is absolutely perfect. Right. And if you are talking about juvenile diabetes, that can be included in diet according to total carbohydrate counting at that particular time period, for that particular meal. So that could be included accordingly. Right. Because if you are talking about juvenile, we cannot restrict even a single thing. Patient or child will definitely ask if you eat, if that things are available in your room or in freezer, somebody is eating. So he will definitely ask. You can counsel that these things should be included in a limited quantity at particular period or occasionally, but you cannot avoid completely.
Okay. Okay, Mr. A.K. Mahajan from Delhi itself, he is back with us online. Welcome to the show, Mr. Mahajan. Please go ahead with the question.
Yes, my wife, in fact, when she was at the age of 54, she developed this blood sugar. So then, see, now she is at the age of 58. Hello?
Yes, please go on. We are listening to you.
So she is taking medicine now. In fact, her blood sugar was about 150 or so, 160. But after taking medicines, that is under control. Sometimes even after taking medicines, she feels weakness and all that.
Please ask your question, Mr. Mahajan, because in any case we are talking with type 1 diabetes, and your case apparently appears to be a type 2 diabetes. But you can ask your question, but please ask your question straight away.
So, is it okay after taking medicine whether she can be purely cured also with these medicines, or any she is also taking exercise?
Well, I think we've said that already earlier in this show.
Yeah, basically I think he is talking about type 2 diabetes. And even there are studies now in type 2 diabetes, over a period of time there is a very slow destruction of beta cells. And after 15 years or 20 years they may require insulin basically. As long as the patient can be controlled with the medicine, oral hypoglycemic agents which are in the market, it is really good. But it is being noticed after 15 years or so, maybe 10 years, patient may require insulin, and at that time we must add insulin to this patient to control the blood sugar levels. And for that we can add a long-acting insulin like insulin glargine, datamir, can be supported by the oral hypoglycemic agents.
Right.
I'd like to add something.
Yeah, please go ahead.
That he has mentioned that his wife feels weak after taking medicines, and I would like to use this opportunity that in type 2 diabetes as well as in type 1 diabetes, sometimes after taking your medicines or after taking insulin, if you feel weak, it could be because your sugar has dipped too low, because you are ultimately giving something to decrease your sugar. It is not something which can be calculated very well, so sometimes the decrease is more than you wanted. And if your blood sugar goes below 70 or 80 milligram per deciliter, then you feel weak, because then that sugar is not optimal for your cells to provide you energy. So that is called hypoglycemia. You should have, all diabetic patients, type 2 or type 1, they should have a glucometer at home. They should know how to check their blood sugar. If the sugar is coming out to be low, like 70, 80 or below that, then they should immediately take something sweet. We normally say 15 grams of carbohydrate, which is a simple carbohydrate, like plain glucose or sugar or some fruit juice, like real juice or something, whatever is available with them, they should take it quickly. And then after 15 to 20 minutes, again check the blood sugar. Okay. If it has gone up beyond 80 or 90, they are fine. If it is again low, then they should again take 15 grams more of carbohydrate and check the sugar. Sometimes in small children, it is difficult to actually find out if the child is feeling hungry or feeling weak. He may not be able to tell you, a small child 2 to 3 years old. Right. So then parents have to be even more conscious. Sometimes child may have some sweating, or he may just look very pale or lethargic. Sometimes very small babies even become unconscious because of hypoglycemia. So it is important that the dietary pattern is followed. They are given proper meals. If they miss a meal, or if inadvertently more insulin is given than required, then they may develop hypoglycemia. So even if they are feeling that, if the parents have a suspicion, they should immediately check and treat. If the child is not able to take orally, then they should just try to put some glucose beneath the tongue and then try to take the child to the hospital, nearby hospital, where intravenous glucose can be given.
Okay. Yes, Dr.
Yeah, she has rightly said, we must watch for the symptoms of hypoglycemia. The patient may develop weakness, sweating, blurring of vision, dizziness during the daytime, and during sleep it may go unnoticed. Patient may have, bad dreams, early morning headache. So all this we should keep in mind when the patient is taking insulin or oral hypoglycemic agents, particularly in old age.
So the insulin level dips suddenly also when you're sleeping?
Yeah, blood glucose level can dip if you're taking overdose of insulin or the oral hypoglycemic agents. Right. So we have to check that.
Right.
And if this hypoglycemia, if this problem persists, like the blood sugar level keeps dipping below 70, 65, patient may develop convulsions and go into coma. It can be a life fatal condition. Right. So we must keep glucose or as she has said, the carbohydrates rich products, juices at home at disposal of the patient, so that he can take it at a very early stage. If the patient is taking insulin and suddenly the child just tells I'm feeling sweaty, I'm feeling weak, I'm feeling trembling, we must think of hypoglycemia, and we must insert glucose to the child in the form of a glucose or juices, whatever is available, so that the symptoms do not proceed further.
Right. Well, it's time for yet another break in the program. We'll be back in a short while. सड़कों पर चलते रिक्शे से भारत के नक्शे को नापता हुआ आम इंसान, रोजी की रस्सी पर चलकर देश की सत्ता को साधता हुआ आम इंसान, हर मुद्दे का हिस्सा होते हुए भी उसकी खबर रह जाती है आम। आपसे जुड़ा मुद्दा अब होगा खास। सिर्फ लोकसभा टेलीविजन पर हर रविवार शाम 7 बजे विशेष आम इंसान से जुड़ी खास पेशकश।
जी मेरा सामान तैयार है।
मैम आपको बिल बनाऊं या बिना बिल के चल जाएगा?
पैसा बताइए।
1550।
सर ये बिल न बनाने से हमारा क्या फायदा है?
बेटा बिल बनेगा तो टैक्स लगेगा। मैडम ये आपका बिल। सामान में कोई कमी हो तो बस ये बिल साथ में जरूर ले आइएगा।
ये है एक अनजान और समझदार ग्राहक में फर्क।
Well, welcome back. You're watching Healthy India, and today we are talking about juvenile diabetes. We have another caller waiting online for us. We have Miss R. Jain from Delhi. Welcome to the show, Miss Jain. Please go ahead with your query. Hello, Miss Jain. Are you there with us? I think we've lost her for the time being. We'll try to come back. Raheja ji, what does your experience tell us? How aware are parents of the role of a proper diet when their kids are diagnosed with juvenile diabetes?
It's really difficult to give them a proper counseling once they come to, but once it is at very first go, they really get disturbed that, and they think that their child is not going to eat or enjoy life as a normal child, but it's just a myth. Through proper counseling of parents and school teacher, that child can enjoy his life the same way as a normal child. So proper counseling is very, very important, and first counseling is very important, where we need to counsel parents that how to, because with little bit of modification, how they can give a normal life to their child. Like what time and why. One thing is very important, that insulin is the treatment. So they shouldn't think that diet is going to help their child anyway, just with the help of diet. So insulin should be given as a physician prescribe or doctor prescribe.
Apart from that, they should also focus on the diet.
Yeah, diet is and next it comes, that helps. Diet only helps to maintain to avoid hypoglycemia, because they are on insulin. So hypoglycemia should be taken care of. And in dietary counseling, they must know that carbohydrate is important, and that should be given in a proper amount, and for that entire diet should be planned to provide a proper growth to that child, and that the dietary pattern should be according to child own schedule. So what time they should give a lunch pack to that child, and how much, and how to give modification, how that mother can modify diet accordingly. So proper, there is we call as a carbohydrate counting once we plan diet for pediatric patient. So once we plan diet, we write down something, some samples, or maybe some suggestion we give that you can plan diet accordingly. If you are giving insulin at this time, and this much of carbohydrate given immediate after that, or maybe after insulin, so the same amount of carbohydrate can be modified or can be exchanged through other type of diet which is going to provide the same amount of carbohydrate. And if mother is going to modify diet accordingly, that can be taken care of hypoglycemia also.
Vannaji, do schools also have a role to play in dietary counseling?
Not exactly in dietary counseling, but yes, schools have a very important role, because the child spends almost half of his day in the school. So many times teachers and even the peer group, they have this impression that this child is diabetic, he can't play, he can't do the same as the other kids. Teachers may make special concessions, okay, even if he doesn't do well in the class, it's okay. But that's not okay. The parents should talk to the child's teacher that the child should be treated in the same way. He should be allowed to participate in sports and other things. Only thing is that when a child participates in sports, he is prone to develop hypoglycemia, because he is doing unaccustomed physical activity, so more glucose is being utilized. So child should be allowed to take an extra snack before he goes on to participate in a sport. If it's a long drawn activity like swimming or a march past for more than an hour or so, then in between he can be given some juice. Or if he is an older child, he can carry his glucometer and even check. For a younger child, the teacher should be provided supplies of glucose and maybe some hard candies, some toffees, some juice packs, which she can keep in the cupboard in the classroom. That if she feels the child is developing some symptoms of hypoglycemia, parents or even the doctor can talk to the teacher to make her aware of the symptoms, so that she should treat for those symptoms. This is important.
Right. There's something else which I would like you to focus on about the role of how does juvenile diabetes or how does diabetes affect pregnant women, and what kind of preventions should they take?
This is a very important question, because we have to realize that these kids who are in our follow-up, when they become adolescents or when they get married, even before they get married, ideally they should be counseled that they have to be very cautious. If they are indulging already in sexual activity, then they should take some contraception. And a married woman should always take contraception. The pregnancy should always be planned, because right from the day the fetus, the child is conceived in the uterus, if the mother's sugars are not controlled, then that baby in the uterus is at very high risk of developing a lot of congenital malformations. So before even planning the pregnancy, the HbA1c, which is a tool to see that the blood sugar has been in good control for the past 3 months, it should be well controlled, ideally below 7.5 or below 7. And then throughout pregnancy, the mother should keep a very good vigil on her blood sugars. They should always be within normal limits. What we normally say is that for adults, they should be ideally between 80 to 150 whenever she checks before meals, and not more than 200 if she checks after taking meals. And her HbA1c should be well controlled. She should be under regular follow-ups of a gynecologist or an obstetrician, and regular ultrasound monitoring to see that the fetus is growing well.
Right. Dr. Raheja, if you could quickly list out some myths that are there in the minds of patients and as well as their guardians regarding juvenile diabetes, and would you like to dispel those myths?
Yeah, the most important is diet. Most of the parents, they feel this disease is because of the diet. It is not because of the diet. As we already told, it has got a genetical predisposition as well as some viral infections, Coxsackie-B and other things. And second, we should really plan the diet of the child and physical activity accordingly. As we have already discussed, that if the patient is going for a severe exercise, we must give extra carbohydrate. And if we are giving extra carbohydrate to a person who is sedentary, we must add extra dose of insulin accordingly.
Raheja, would you like to add something to that? I'm talking about myths that you would like to dispel.
It's like they think that child, as already mentioned, that child cannot lead a normal life, which is not correct. Child can lead an absolutely normal life, only like education is needed, and for that proper counseling is needed. And because we are talking about juvenile diabetes, so there is a growth, and every year child is growing, every year requirement is increasing. So that parents should be in touch with dietitian, ideally on monthly basis if it is possible, or 6 monthly, or if it is not possible, then it's recommended that yearly basis.
Right.
And then only they can come to know what all they can add in child's diet without hindering or affecting his growth.
Right. Well, that's something very important that I think there will be of immense use to our viewers. Well, it's time now for us to show you a report which would recapitulate a kind of a crux of discussion. It will again show you the symptoms of juvenile diabetes and what care should be taken. The symptoms of type 1 diabetes may occur suddenly and include frequent urination, increased thirst, extreme hunger, unexplained weight loss, extreme weakness and fatigue, urinating at night, blurred vision, numbness or tingling in the hands or feet, heavy or labored breathing, drowsiness or lethargy, fruity odor on the breath. Complications: if juvenile diabetes is left unmanaged, damage can occur to eyes, leading to diabetic retinopathy and possible blindness, blood vessels, increasing risk of heart attack, stroke and peripheral artery obstruction, nerves, leading to foot ulcers, impotence and digestive problems, kidneys, leading to kidney failure. Treatment: diet, insulin, self-monitoring of blood glucose, exercise. Well, that's all in today's discussion. Before we end the program, I would like to thank my esteemed panel of experts here. So Dr. Raheja, would you like to say something?
I would
like to be very brief. Very brief.
You know, the patient of diabetes may present with repeated infections, skin infections, furuncles, upper respiratory tract infection, lower respiratory tract infections. So we should also keep these things in mind.
Right. On this note, it's time for me to thank all three of you so that you came here and spared your valuable time in telling our viewers about juvenile diabetes. Thank you very much. How did you like the show? If you have some comments, you can write into us. Here's our address.
Healthy India, FB 116, Lok Sabha Television, Parliament Library Building, Parliament House, New Delhi 110001. Email healthlstv@gmail.com and our toll-free number is 1800115314.
Well, that's all in this episode of Healthy India. We'll be back next week with another health issue. Till then, it's time for me and my team to say goodbye. Stay tuned to Lok Sabha TV and thank you for watching.